Hey guys, so the drug for the day is Abies Canadensis. Common name is hemlock spruce. Now the method that I've used for this drug is what I call as pathological correlation. Now, by no means I'm saying that this drug is indicated in this particular pathology only. We know that if symptoms match and they are right and fitting, then they can be a part of any pathology, be it as simple as a rash to as complex as cancer. But at the same time, such small drugs need a chain of thought to correlate and to remember all the small symptoms that are scattered and present in the drug. This chain of thought is necessary and this correlation is necessary, otherwise these drugs will just become the ones we never prescribe. So I've read this drug a few times and there's one thing which stuck to me, actually two things, after which the drug just falls into place. First is sensation as if. So there are two sensations. One, that the liver is hard and small. Like I said, we will be relating it a little bit to pathology. So this condition is cirrhosis by all means. Now in cirrhosis, the patient will not feel that his liver is small and hard. This is what a physician while examining will understand, but let's not bring that. So in cirrhosis, there is decreased functioning hepatocyte and there is fibrosis. Okay, before that, there is another sensation is of the lung, especially the right one, being hard. So this is again fibrosis. Coming back to cirrhosis part. So in cirrhosis, the normal functioning hepatocytes are less in number, so the normal functioning of the liver will decrease. The main affected functioning which is decreased, according to me, is decreased production of fibrin and collagen. This is the main aspect that has hit in the remedy. What is this causing? What is its effect? Is A, there is weakness, generalized, and another thing is weakness of muscles, which again is a factor contributing here, and ligaments. The main place where we can see this weakness of muscles and ligament is in the uterus. The uterus feels soft and feeble, which is quite opposite to liver being hard and lung being hard. There is easy displacement. The displacement is so easy that the patient feels that the uterus will drop down of the pelvis, and the only way she avoids is by sitting with leg crossed up. So this one is characteristic symptom. This is where you can prescribe the remedy despite cirrhosis. Easy displacement, and there is a sore spot at fundus, which is better by pressure. Next we go on to, like I said, the lung feels hard. They've mentioned the complete right lung feeling hard. So fibrosis has to be extensive by common sense. When fibrosis is extensive, so the lung is not functioning to its optimum level. I mean, the whole right lung has undergone fibrosis. So there will be labored breathing. Books have also mentioned the labored breathing to be due to distension of stomach and abdomen, which seems unlikely, but since they've mentioned it, and this distension of stomach and abdomen can cause malassimilation. So basically some GI issue which is causing malassimilation, which is causing generalized weakness. So this is one part of the remedy. What is the another part is, now you'll say that I have not mentioned about the appetite, which is like the most important factor of the remedy. Now appetite in cirrhosis is usually reduced, but as opposed in this remedy, the appetite is increased. And also there is a peculiar sensation of chilliness and coldness which is present in the drug, and I was thinking how could these symptoms be related to it, and I couldn't find anything much. So I think there can be some CNS or hypothalamus, because hypothalamus in itself is related to hunger and satiety center and is also thermoregulatory center, a tumor or a lesion. Why I say so? Because the appetite is increased to the extent that the person cannot digest that much food beyond the capacity to digest. So when there is simple pathology, or suppose there is gastritis or there is simple inflammation, the body as a defense decreases the appetite. Unless there is some bigger locha, this doesn't happen. Although it can happen in another conditions also, like hyperthyroidism. The appetite is increased more for meats, radish, pickles, coarse food, artichokes and turnips. MRP cat. Like I said, there is one more symptom of coldness and chilliness. The coldness and chilliness is such that the person feels as if ice cold water is flowing in his vein. This symptom is also present in aconite. At the same time, there are peculiar chilly symptoms at the back. Assume this is the back. The patient feels as if the cold air is blowing up and down the back. There is coldness in between the scapula. The person feels as if there is some moist cloth placed on the back. Now, since we're talking all about moist and water, there is one more sensation in the head, as if the head is swimming. Now, this sensation is usually associated and is mentioned as tipsy headache. Now, tipsy can again be one of the factors that is contributing to cirrhosis, although the complete picture of an alcoholic does not fit in the remedy, since he doesn't even have any peculiar craving as such, but it could be one of the cause for cirrhosis, just because they've mentioned tipsy. So this is the drug for you guys. I hope it's much easier to remember. Thank you.